Hello everyone! I'm the head nurse Özlem.
And I'm Kristina, I'm physical therapist.
So we are together with our patient from
the US, from San Diego.
And he is a
pilot. I'm an airline pilot and been flying for the airlines for about 6 years now. And I'm in the Air Force as well. And been flying for over 10 years now.
Wow, amazing. So how do you feel now when you brought you to the hangar? How does it feel being here amongst the airplanes, amongst your colleagues?
It actually feels great to having been around airplanes for over 2 months now. It's been a long time for me, so it feels great. Brought me back to life. Thanks.
You even tried some simulator?
I did. I tried the Cessna 172 and it was great. It's a good to fly. It was fun.
How did it feel?
It feels great. It feels.
Yeah, he was playing on the Sabiha Gökçen.
Yep, I did. Hopefully nobody tells anybody.
Is it the first time trying Cessna?
Oh no, I actually trained a lot of students on that airplane. So yeah, that's what. Yeah.
So today we are going to talking about the lengthening, your lengthening experience, also about the physiotherapy and medical sides, and also we're going to talk about something the pilots. What do you do in your normal time? What did change in your life? So something like that.
Of course, perfect.
So let's start maybe with some obvious questions. So
Yep.
you are a pilot, and pilots have a class 1 health certificate. And how did you make this decision to do this surgery?
Yeah, actually I decided to do the surgery within 2 months of finding out about the surgery. So of course I had to take a few steps, take the time off, and then of course once you decide to go for a surgery, they take your medical certificate, so you're not able to fly anymore. So they take your medical, you just take the time off, whether it's 6, 7, 8 months, and then you just go on disability, because at this point you can't really fly an airplane. And that's it. It wasn't that hard. It was a very easy process for me. I just filled out the paperwork, and within 2 days it was approved, and I had the time off.
Did you have any advice from your aviation doctor?
Yeah, they were a little bit. Yeah, I spoke with a few people. They were kind of like nervous about the surgery. Like, yeah, it's not a good idea, especially if something happens to you, that's it, it's the end of your career. But I spoke with other doctors, and they said it's pretty safe. So I went ahead, and I saw a lot of patients who were walking. Everybody's fine. So I was like, you know what, I'll take the risk. It's fine.
Okay.
So my favorite and most important question is, I think this is pain. So how did you feel after the first time after the surgery? How did you feel? How was your pain? How did you manage it by yourself in a hospital?
I usually tell everyone, for me it was the first 10 minutes actually after the surgery. Everybody, they saw me in the surgery. I was in the hospital sleeping for 13, 14 hours. Yeah, I had fun in the hospital. I was eating, sleeping. I had no problem. Just the first 10 minutes, because they couldn't give me painkiller because my blood pressure was kind of low. They said we have to wait 10, 15 minutes. After that.
Yeah, of course. Before the medications, of course, we have to check something in here and in the hospital. So if your blood pressure is available for the painkillers, we never give that. So
that's what happened, and then after that, it was fine. I would say first week, yeah, sleeping was kind of hard, but it was. I always say it's not really pain; it's kind of discomfort. You just feel weird. There's different device on your leg, and you feel like it's a weird feeling, but it's not really that painful. I know, I think so too. Yeah. Well, now I'm used to it. Actually, I'm like very used to it. I don't even think about it anymore.
Part of your body.
Exactly. Yeah. I'm gonna miss it when I remove it.
I have a question. So, do you think it's important for pilots to be tall or not?
That's a good question. So there's actually no height requirements for pilots. You could be as short as 150, and you could be as tall as 2 meters. Doesn't matter. But it's always that, like height is very important. It's like everywhere. Like you see that, like whether you're dating, you're getting a job, anywhere you go, it's like they expect you to be like tall, and I think it looks good. In uniform, I think I'll look better when I'm taller.
Yeah, that's definitely.
yeah, of course it will be.
Take a picture from Melton, please.
You're going to tell her. Look, you have to hold.
Oh no, sure, I'll take it.
I'm recording this.
Oh, perfect. Coffee break.
It's decaf.
Wow, I have it. Oh wow, this is great.
So I wonder just one thing. Do anybody know that surgery on you? Did you tell someone?
I said I'm going through a surgery, but I didn't say what surgery I'm going. But you know I'm doing the surgery.
So what do you think about the people's reaction when you go back to your country? Or your family, friends, or your
maybe
girlfriend if you
colleagues?
have?
Honestly, I have no problem. I don't really,
No problem.
even if they notice, that's good for me. I was like, yeah, I got taller. I don't think it's an issue for me. I don't think it's gonna be an issue. Yeah, I think it's, I'm not gonna hide it.
Are your all friends are taller than you, or?
No, I actually have a few friends that are shorter than me. So they're gonna be surprised. I was like, oh man.
You know what? Because I'm short. I understand.
Exactly. So they probably I look the same for them. Like,
Maybe.
yeah, but
They're more taller than
exactly.
they're gonna change
Their eyes, yeah. I was like, oh wow, we got taller. I was like, yeah, I was drinking milk every day.
As a pilot, I guess you still need strong legs, right?
Exactly.
Push the pedal, especially at the engine failure. And I think you tried to push it.
I actually pushed like half away, so I wasn't expecting that. I thought I wasn't even gonna be able to push anything, but
you're able.
yeah, I actually pushed like half away, and
So to be honest, I know nothing about the pilots. She knows better than me, I think.
she does.
So she's asking something, but I wonder what will change in your life after the surgery as a pilot, or yeah, you already told something, I understand, but I mean, what are you gonna do after the surgery?
it's a good question. I think it's just generally you're gonna be happy. Like always short guys, growing up, you always feel short. You just feel weird. So I think changing that, you're just gonna feel better about yourself. But everything I think is gonna change. Like whether you like for some guys dating, or for them getting a better job. Some people think being taller probably give you more opportunity to get a better job. But for me, it's just gonna be life in general. Is just gonna be. At least I'm not just gonna think about being short anymore. Exactly. I'm just gonna get that out of my head. Okay, I'm not short.
But you don't give an impression of a person who has a low self-esteem. You look very confident.
And I was very confident too. I tell everyone I've never had an issue like with being short. But you always feel like something is missing. Just I don't know. Just you look at the mirror, something is missing. Okay, probably my height.
Do you notice now that you're getting taller by
Oh, definitely.
5 centimeters, right?
Oh yeah, when I first came in, like you were taller, like very like tall. So I was like, oh wow, her height is great. Now I'm almost as tall as her. I was like, oh wow, it feels great. You're definitely gonna feel it, especially going like 4 or 5 centimeters. You really feel it.
The next question is about your sleeping, because I remember you had some sleeping problem for during the lengthening procedure for the first time in here maybe. So do you have the same problem right now, or how did you manage that problem?
I'm actually getting much better now. I'm getting like last night I slept 5 hours, 4 hours, but the night before I slept 7 hours. The night before it was 8 hours.
So with the medications, or did you sleep by yourself?
You get used to sleeping on your back, your stomach. Once you get used to it, you're sleeping anymore.
You're just feeling like this is like your normal life.
Exactly. You just feel. I think your body get used to anything after like 2-3 weeks. Like whatever you go through, just your body get used to it, and once your body adapts to the new.
Yeah, maybe the most hard times in the first weeks, I think.
Mm-hmm. Exactly. I would say the first week or two. After that, it's just very comfortable. Yeah.
So I want to ask, maybe it's a bit too personal, but like, did you have any regrets about doing this? Or?
Good question. I would say only the first day after the hospital, I was like, oh, what did I do? Now I can't fly anymore. But then it was just thoughts in my head. But then after that, I was like, well, remember. So it's funny because I wrote things before coming here. I was like, hey, you gotta stay strong. Remember why you did this in the first place. So I always remember that. I was like, yeah, you know what? You did all that. You took the time off. Just finish it. So it was the first day. After that, when I saw myself walking and
This is
seeing other
important thing, maybe,
exactly.
for the motivation.
Exactly.
You have to feel
once you see the process, you feel great. And now I'm like bending my knees. I'm standing, walking.
Everything is perfect about him, by the way.
Thanks.
So we have no problem.
Oh, I have no issues so far.
Going good, I think. I don't know your opinion.
Yeah, he's definitely good. Flexibility is fine. Muscle strength is also good. So yeah, really.
For the medicals is
perfectly.
Yeah, I also feel great after Kristina's session. The medical team too take care of you. They just whether you have pain or like you have discomfort, they will come and check on you and make sure you're comfortable. Overall, so far it's been very smooth for me so far. So I hope it stays like that. I'll probably finish lengthening in 3 more weeks. So it's been great.
You never forget that place, or I was saying to her that faces, for example.
Oh, of course not.
Never forget.
Never.
Because yeah, to be honest, your life is changing in here. So
True.
if I do the same thing, I never forget these times.
Of course not. It's just that, especially like here, like it's not like the US or some other countries where you do the surgery and leave. No, you're staying here for like 2-3 months. Yeah. So you get used to the people. It makes you feel kind of comfortable around people. You don't want to do this surgery alone. Trust me, guys. Don't do it alone. you will regret it.
Did you have expectations before you come here, and what was the reality?
That's actually a good question. So I was very prepared to just come here and not be able to walk for a few weeks, and I was prepared to just be in bed. And I'm just mentally prepared. So, and I had no problem before that because I was always home. I go to the gym, fly, come home. So I had no problem staying in one place for a long time. But I was actually surprised. I started walking within the first week and second week, and now I'm just singing in the lobby all the time, talking with other patients, and I'm having a good time. So it's different. And I'm actually seeing people they recover very quickly too. Some people, they're slower, but most of the patients, they remove the fixator and they're walking within a few days. So it's gonna be, I think it's gonna be great for me. So make sure you watch my video.
So have you been to Turkey before? Or?
I flew into Turkey twice, but never been to the country, never get to explore. So hopefully after the removal, I get to walk around and see Turkey.
Now you take physical therapy sessions 3 times a week. What do you say? Is it possible to do lengthening without physical therapy?
Impossible. That's why I tell everyone. There is no way. There's no way. There's no way you can do the surgery alone. I mean, even if you're a superhero, there is no way you can do this alone.
Physiotherapy is
it's very, very important. Yeah, just staying in bed for 3-4 days without physiotherapy, you're probably gonna lose everything. Flexibility.
you can length maybe, it is not a problem.
Exactly, but you're gonna lose everything. You're probably not gonna be able to walk for.
But also medical team as well.
It's very, yeah, exactly. When you're in pain, you're you have anything, you just text them, they just come over. It's very important to have someone.
Do you remember this couple weeks maybe where you had pain in your pins, right?
I did, yeah.
Yeah, they were ripping out, right?
Correct.
Yeah. Well, what can you say about that? How was it? Why does it happen?
Maybe we can talk something about the skin damage. He had some problem, something like this, because with the lengthening, you're growing with the whole body. I say same thing to all patients before the surgery. Of course, after the surgery, you're gonna have some skin damage. This is real, so that's why you had some skin pain. But I think we managed it, right?
Oh, it was it was for a day or two, and he helped me out too with some.
Teamwork.
Yeah. I think it was a laser treatment, and she did some hangar, I guess, device. Yeah, so it really helped, and yeah, it was gone within 2 days, so it wasn't that bad.
There's something like muscle pain also, I imagine.
Yeah, muscle pain is it's not really pain, but it's just discomfort. Just like when you work out and you leave the gym, your muscle get tense. Same feeling. It's not that bad.
The important part is after the surgery, we always connect with physiotherapists and the nurses. We always talk each other
Exactly.
about the patients. We always plan everything about the patients. We always make plans.
Oh, I actually like that. When I had I had nerve pain for 1 day. It was very minimum though. It was 2 out of 10. And I told Kristina, and she spoke to the medical team, and I didn't even have to take any medication. They did a laser treatment, and it was gone. So that was very helpful too. It was a teamwork. It's just a teamwork, all 3. Exactly. Oh, that's very actually important. Patients, just listen to them. If you want to walk out of here healthy, trust me, this is what you want to do. You don't want to listen to any patients. You don't want to listen to anybody. Just listen to your medical team, your physiotherapist, nutritionists. You'll be fine.
Thank you.
No, this is actually very important. I swear, I've been listening to everyone and I feel great. Just listen to them and you'll be just fine.
Yeah, of course, after this surgery especially, maybe, of course you have some mental problem, you don't want to see people, you don't want to listen to them, but this part is really important. Just listen to your physiotherapist and nurse.
Exactly. It's not just surgery. I mean, Kristina, sometimes I would even talk to her, I was like, hey, listen, I think I should stop at whatever, 6 or 7. What do you think? She's like, no, I think you should. She knows. She was like, no, I think you could keep going, you're fine. So even if you feel down a little bit, you feel lonely, they would even took you through it. So that was actually nice.
Yeah, of course.
Yeah,
I mean,
we
we
are
always say
here for you.
Oh yeah, thanks. Yeah.
As a patient, if you need something, you can find us easily.
Exactly. And this is what I like about just all you do is just text. Oh, I want to actually mention something. First day I came to the center, I actually had to mention this. First day I came in, so I was first day out of the hospital. Well, my walking wasn't that great, so it would probably take me forever to get to the bathroom. So at 1:30 in the morning, I texted Sedat. I said, hey, I really need to go to the bathroom, but it's gonna take me forever to get to the bathroom. I texted him at 1:30, and I still have the text. You can even put it on the screen. He responded at 1:31, within 1 minute. I had somebody in my room just put me in the toilet. that was great. I just felt great. It was very quick, and they're very exactly. So that was awesome. I just want to thank him.
Because you're a patient, you need something. We have to help you.
Exactly. All right, so I think that's it,
Yeah,
right?
Yeah, I think that's
Yeah.
yeah. I guess everything.
Thank you so much for your answers.
Oh, thank you.
It was a
Thank you.
really a pleasurable talk.
Yeah, me too.
I'm so happy for
Yeah.
being here with you.
Yeah.
Between me and you guys, do you think I'm gonna fly again? I'm just kidding. I just keep telling Kristina.
No.
This,
Of course, no, like in general, I think.
I think here, why this is the best place to do the surgery is because we care about bringing you back to your environment and to your profession.
Yep.
Because what's the point of doing this if you cannot enjoy your life after
Exactly.
this?
Yep.
So that's why we're doing our best. So guys, thank you for watching us. We had a pleasurable talk with our pilot patient, and hopefully you liked what you heard just from him.
The only thing I would add is if you're, I know some patients who just want to do the surgery and just want to go home because you miss home or you want to be with your family. Trust me, it's not a good idea. If you're coming here, you have to stay here. Trust me, for your health, for like you're not gonna find the same care that you're gonna find here back home. It's like they're available 24/7. So if something happens, they're gonna be at your room within minutes, and you're not gonna find that anywhere. Physiotherapist, same thing. You can't. There's no way you can do the surgery without their help, because every day you have muscle tense, wherever you have, whether it's a nerve pain, you have pain, they help you out, and you trust me, you just feel great after walking out of the physiotherapy. Same thing with the medical team. If you have any issue, they've done thousands of the surgeries. They know how to deal with whatever pain you have, or whether your case is just it's a pain, it's a nerve pain, it's a muscle tense. They know how to deal with all of that. So just would be a great idea if you just stay here, walk out of here, and you're gonna feel just like you came. Probably better. I feel better now. Actually, I actually do. Mentally, I feel great now. Yeah.
thank you so much for your good words.
Thanks. Yeah, my coffee's done. Oh, I love it. Oh, I finished it.
I had half coffee.
5 days, 6 days.
No way,
Yeah, my
when?
birthday in December 5.
Mine is December 3.
No way.
Yeah.
Good together.
Yeah.
Perfect.
We're Sagittarius.
Yep.